Hi everyone, welcome to Medical Coding Made Easy. In this video, we will see about excision procedures of benign and malignant lesions on the skin. To begin with the excision of lesions on the skin, whenever we are reporting these lesions and its excision, we have to report it for the measurement of excised diameter. And how you will be calculating that excised diameter? Excised diameter is equal to diameter of the lesion that is removed plus 2 times the margins of the lesion. So with the help of this formula, you can calculate the excised diameter of the lesion. So that is the first thing to be done whenever we are reporting excision of lesions. For example, in our book, we can see so many pictures of excision of lesions. Under that, I'll explain one example over there. If I'm going to remove 0.9 centimeter lesion with 0.3 centimeter margin, what is the excised diameter of the lesion? The excised diameter of the lesion will be 0.9 centimeter plus 2 times 0.3 centimeter, which is equal to 1.5 centimeter. So that is how you have to calculate the excised diameter of the lesion. And this is calculated like this because we are going to remove 0.3 centimeter margins from both above and bottom of the lesion. So you have to add that margin that has been removed on both top and bottom of the lesion. And sometimes in the questions, they will mention that doctor has removed 0.2 centimeter margins from both top and bottom of the lesion. Then you don't have to multiply the margins. Okay. If they have just given 0.3 centimeter margin has been removed, then you have to multiply it. And if they have given like this 2 centimeter margin, 1 centimeter above the lesion, 1 centimeter below the lesion, then you don't have to multiply it. So this point should be very clear. Okay, so then only you can calculate the excised diameter exactly. Okay, now let us move to the guidelines. And whenever we are reporting these excision of lesions, we have to check whether the lesion that has been removed from the skin is benign or malignant. Benign lesions are non-cancerous lesions. Malignant lesions are cancerous lesions. So first thing is you have to check that. Next thing is you have to check from which anatomical part of the body they are removing the lesion. Is it from the face? Is it from the arm? Is it from the chest? So second thing is that. Third thing is you have to check the excised diameter of the lesion. Sometimes in the question, they will be giving you the excised diameter directly. Sometimes they will not give it. Then you have to calculate it according to the formula which I told you before. So like this, these are the 3 main points you will be looking for when we are reporting the excision of lesions. Other than that, you have to check what type of repair has been done. If repair has been done, that has to be reported separately if the repairs are done with complex repair or intermediate repair. Remember that simple repair is included in both excision of benign and malignant lesions. We don't have to report that separately. And sometimes they will give you questions with excision of both benign and malignant lesions. In that case, you have to report malignant lesion removal first, and then you have to report benign lesion removal with modifier 59 to say that these 2 procedures are done as separate and distinct procedures, and we are reporting malignant lesions first because that is considered as the most complex procedure. Now let us see some names of benign lesions that are removed from the skin according to our book. You can see there neoplasms, cicatricial lesions, fibrous lesions, inflammatory lesions, congenital lesions and cystic lesions are all considered as benign lesions. And also one more thing you can add is lipoma. Lipoma is a benign lesion which can occur on the skin. So that can also be considered as a benign lesion. And whenever a benign lesion is removed, simple closure is included and also local anesthesia is included in that procedure. So we don't have to report them separately. The next guideline is if repair or the closure is done by intermediate or complex repair, you have to report separate codes from the repair section with modifier 51. And also remember that with adjacent tissue transfer, you don't have to report any excision codes because excision is included in adjacent tissue transfer. Now let us move to the codes. Starting from the code 11400 till 11406 will be used for excision of benign lesion including margin except skin tag, that are present in the region of trunk, arm and legs. And also depending upon the excised diameter of the lesion, you have different codes. And the next code will be from 11420 till 11426. This all belongs to the anatomic region of scalp, neck, hands, feet and genitalia. And again here also we have different codes based on the excised diameter. The last set of codes from 11440 till 11446. It is all belonging to the anatomical area. Face, ears, eyelids, nose, lips and mucous membrane. Again depending upon the excised diameter we have different codes here also. And apart from the benign lesions, under excision of benign lesions we have some more code for the removal of hidradenitis suppurativa. So this affects the hair follicles in certain regions like axilla, inguinal region, perianal region or perineal region, and depending upon the method of repair that is done after the excision, we have different codes over here. Next is we are moving to excision of malignant lesions. Malignant lesions, as I said before, it is cancerous. The cancerous conditions which can affect the skin are basal cell carcinoma, squamous cell carcinoma and melanoma. And apart from this, sometimes in the questions they might give the lesions with positive margins, that is also considered as malignant lesion. And the same guidelines for benign lesions is applicable here also. Excision of malignant lesion includes local anesthesia and simple repair, and if the doctor is doing a complex or intermediate repair, you have to report it separately with modifier 51. And also if adjacent tissues transfer is done after the excision, you don't have to report excision as a separate code, because adjacent tissue transfer is inclusive of excision procedures. And also one more guideline is there, you can use modifier 58 if re-excision of a lesion is done during the postoperative period of the primary surgery by the same physician. So now let us look into the codes. Starting from 11600 to 606 will be used for excision of malignant lesions from trunk, arms, other legs, depending upon the size of the excised diameter. The next set of codes is from 11620 till 626. It belongs to the anatomical area scalp, neck, hands, feet and genitalia. Again here also depending upon the excised diameter of lesions we have different codes. The last set of codes starting from 11640 till 646. It belongs to the anatomical area face, ears, eyelids, nose and lips. Again depending upon the excised diameter the codes are different. So that is how benign and malignant lesion removal has to be reported with the codes. Now let us try to solve this question. The physician excised a 5 mm excised diameter benign blue nevus from the patient's arm and performed a simple closure for a patient for which the physician reported CPT code 11400. A month later, outside the postoperative period, the same patient as in the above question returned to her surgeon's office with a 2 cm malignant lesion on her arm. In order to ensure that the entire malignancy was removed, the surgeon excised a 2 cm lesion and 2 cm skin margin, and within bracket they have given 1 cm above the lesion, 1 cm below the lesion. This was the narrowest clinical margin required to adequately excise a lesion. And how should this be reported? Now here in this case, patient has come for a removal of malignant lesion in the arm. So you have to find the codes from arm section in malignant lesions. And also the excised diameter of the lesion will be 2 cm plus 2 cm, which is equal to 4 cm. So the answer will be 11604. Because it is a malignant lesion that is removed from the arm of excised diameter 4 cm. So the answer will be 11604. You don't need any modifier 58 here because this is not within the postoperative period. Now here is one more question. Dr. Jess removed a 4.5 cm excised diameter of the cystic lesion from Amy's forehead. The ulcerated lesion was anesthetized with 20 mg of 1% lidocaine and then elliptically excised. The wound was closed with a layered suture technique and a sterile dressing applied. The wound closure according to Dr. Jess' documentation was 5.3 cm. How would you report this procedure? Now you should remember that guideline, what I told you before. Whenever simple suture or simple closure is done, we will not report that. But if it is layered suture or intermediate suture, or if it is a complex suture, you have to report a separate code for that. So according to the guideline, what will be the answer for this question? So all of you give it a try and just comment your answers. And let me see how many of you are answering this question correctly. And thank you for watching this video. And please subscribe to my channel. Thank you.